Okay, hey Dr. Shaw here, back with a new video. I'm here with Dear Shah. Did I get that correct? Dear. Okay, Dear's first time being patient. He came in from YouTube because he was interested in the ring dinger. And you're an interesting case because you're not that bad. Sometimes people come in, raging sciatica down the leg, they're 8 out of 10, 9 out of 10. You said you're 3 out of 4, 3 out of 10, which isn't that bad. But what we did is we looked at your posture, and I'm just going to have the camera see this because a lot of times the camera likes to see this program. Your head, based on your height and weight, should weigh about 13.2 pounds. It shifted forward is about 2 inches, effectively making your head weigh 36.3 pounds. So it's a lot of extra weight there carrying around, and what extra weight does, it puts pressure on muscles, joints, ligaments, and nerves, and when it's pressure on those muscles, joints, ligaments, and nerves, it causes pain and dysfunction. So we did a couple orthopedic tests, we looked at your posture, we did your family history, we did your history, you're cleared for the ring dinger protocol. We're going to start by laying face down, okay? All right, so we're going to start from the lower spine and work our way up. So your previous chiropractor, you would get generic full spine chiropractic adjustments?
Yep.
Okay, so what's different about the ring dinger protocol is we don't like to do side posture adjustments, we like to stick with the drop technique. Okay, so left side short crosses over. We're going to start with the drop on the left SI joint. Good. Side joint. And for the people watching the YouTube videos out there, I am putting a lot of force into the drop, but the table is absorbing all of the force. So the segment moves underneath. Drop is super effective because people with bad discs and herniated discs, it doesn't irritate it as much as a side posture adjustment that's using a lot of torque. This is a nice way to address that. So we're dropping into the pelvis and just balancing his pelvis out. Okay, so we're going to work on that. What I tell you to, I want you to take your knees and I want you to kind of bend them this way, okay? So take a nice deep breath in and bend your knees the way I showed you. All the way, all the way. Wow. That was a big release, huh? I wish the camera got that mic'd up. That was so epic. Breathe in and let your air out. Good down. Leave that one alone, okay? And when I mean leave that one alone, I didn't get an audible release or a massive release. So I'm not going to try and force it. I found after 27 years of experience, it's best if it's not going to go, respect that. Drop this. Let's see if we get that. There we go. Good. Breathe in and let it out. Drop this down. Beautiful. Flip over and lay on your back. So yeah, like I said, if it's not going to go, it's best not to force the adjustment. That's how people get hurt. All right, now we're going to do the unload your knee, hip, even into that lower back. Drop this. All right, good. And talus, which is the weight-bearing joint of the foot. Okay. We're going to get into the knee, hip, and lumbar spine. There we go. Right into the talus. Once again, drop this. Good. I want you to sit up facing the team ring dinger side. All right, good. So we're going to adjust you shoulder. Check this out. And then after I'm done adjusting you with the ring dinger, I want you to tell me what you notice is different. Sit up straight. There we go. Good. Relax this. Drop this. There we go. Felt audibles both times. Okay. Hop up on a table. All right. So slide down towards your feet. Beautiful. Right about this. Perfect. Keep your hands, your fingers interlocked together. Good. Okay? And then I'm going to put the pins on. This is everyone's least favorite part. I don't think there's any way around making this comfortable. Okay, so breathe in and let you get all the way out. Good. That's one. Okay, good. That's pretty snug. That's not too uncomfortable, right? Okay, good. Mouth closed. I'd like for you to keep your tongue in your mouth. Just breathe in and out through the nose. And when I'm ready to pull, I want to distract you by telling you to do something with your feet. Okay? Some doctors say turn your belly into jelly. That's Dr. Aaliyah's line. He actually referred me a patient today. So we all work in the same team, ring dinger. So my line is touch your toes. So let me see you touch your toes together, just like that. Okay, good. So keep your mouth closed. Take a nice deep breath in. And let your air all the way out. I'm just going to give you a couple pre-pulls just to kind of gauge where you're at. Good. Take a breath in and let it out. Good. Relax this. Good. One more time. Breathe in and let it out. Good. Let me see you touch your toes. Touch them. There we go. There we go. Okay. So, catch your breath. I know you're laughing. Just rest your head down. Good. Comfortable. What's different about that adjustment? So, because people are going to be watching this YouTube, they always want to know your reaction. Did it hurt?
Slightly.
Where? At the hips? Or the lower back?
Mid-back.
Mid-back. That's kind of why you're here, right?
Yep.
So generally what I find is when we do the pull, it almost always goes to where it needs it the most. So if someone has a lower back problem, it goes to the lower back. If it's in the mid-back, it goes to the mid-back.
And then that's really what I was expecting, and I'm glad that's what happened.
Good. That's why I'm here. That's why people come from wherever they come from, because I'm the doctor that does the team the ring dingers in New York City, New York State. Drop this down. Good. Drop. That's the rest of that. Stay right there. Okay, good. Good. Reflexes. To turn your whole body facing the window. So now you can turn your whole body completely on your side. Great. Now with this hand, this pushes, you're going to come up to a seated position. So push up and swing your legs off. Rest right there for a minute. Catch your bearings. Don't jump right up. Sometimes people are dizzy. Turn around this way. Okay, head right there. Open, right this, scapula together, and I'm going to bring your head back into extension, and I'm going to bring your body backwards. Don't worry, I'm not going to drop you, okay? This is just a proprioceptive adjustment, working on the neurological patterns that go up to the brain that tells you where you are in space and time. So the people that are watching this that are chiropractors or chiropractic students, I know I have some of them, there's a lot of nerve endings. You'll learn about this in basic science class, that you have proprioceptors and mechanoreceptors that are responsible for joint awareness. They're everywhere in your body. So this is just a neurological adjustment using the arthrostim. Okay, hitting the area of chief complaint. Good. Okay, good. Okay, now you can have your body back. I want you to walk back and forth, and then in your words, tell me what's different. Turn around. Yeah?
More stability.
More stability?
Yep. Walking back and forth.
A little more balanced.
Yep.
Okay, you look a little bit more upright as well. So, what we would do is, since we have time, why don't we take another picture,
Okay.
and we'll see where your head's at. And this would be great for the camera, because a lot of times I do the one picture and I don't do anything after. But so your head effectively weighs 36.3 pounds before the adjustment. So now I'm going to do another one, and let's see if I can do a comparison. Picture from the front. Turn your whole body facing the outside. And now facing the outside again. You just digitize your posture and let me do a comparison. Okay, so client list. So the first time we did it, 36.3 pounds was your head. The second time we did it, we just took 5 pounds off your head, 31.9 pounds.
Okay.
So a significant difference. It's one visit, usually over a series of 6 visits. But one of the things that I did notice is your pelvis is aligned and balanced. I don't know, you're square, you're in there. And from the back view, your shoulders are level and you're balanced. So when he came in, posture, shoulder was riding high on one side, and we can see both. So let's do to the first one. And when we look at you from the back, your left shoulder is riding high. Okay, now the one that we just did, client list, 31.9 pounds, you're centered, and from the back, less riding high. So objective findings, improved patients. So when you said 3 or 4, when you came in, what about right now? Are you still at 3 or 4? Worse, better, same?
50% or more at least.
So, okay, 50%
Better.
or more, better.
Yeah.
That's generally what I like when a patient comes in and I feel accomplished. If you come here spending hard-earned money for you to get an adjustment and leave 50% better in one visit, I'm happy. So over a series of 6 visits, we're looking for 100% improvement. And that's why what we do is different than most other chiropractors, but I'm glad you made it here. And instead of going to Houston, or instead of going to Dallas, so the viewers out there, I am in New York, And we do the ring dinger. I've been doing it for 4 years, and you can see he's a happy patient. All right, good. So that's a great video. We'll see you in the next one. Typically, when people come in for the ring dinger, people are in a worse shape. They're 8s, 9s. People that have had surgery don't want surgery. Not very frequently do you have people come in that come in with a 3 or 4 out of a scale of 10. So he came in with a 3 or 4, found out after his exam he had a lot of postural distortions that needed to be addressed. We addressed them with full spine, ring dinger, Johnson technique, and then he said he had a 50% improvement. So not the typical case, but interesting nonetheless when people come in that don't have acute symptoms or chronic symptoms and they're interested in addressing overall systemic and postural health with chiropractic. We always like to hear from potential new patients about their complaints, and we can find out whether they can help them. We have people that are visiting from all over. We have patients scheduled in August from New Zealand. We have patients scheduled from UK. So if you're watching this video overseas and you're planning a trip to New York, it's a great time to visit New York in the summer. I will be accepting new patients. So if you're watching this video and you're overseas and you're coming to New York and you're considering booking, give us a ring. We'll get you in the office.